Health leaders say the Delta variant is everywhere locally. All of this is worrisome as some of the hospitals in our area are already in crisis mode. Anayeli Ruiz is in the Texas Medical Center where they are working to figure out how to deal with another possible surge in cases. Anayeli?
Well, that's right, Mia. Doctors are concerned because they're already stretched thin and things are getting tough over here. They're even asking people to stay out of the ER if they're not in dire need. COVID-19 cases are rising and officials predict it's only getting worse. Just yesterday, the Houston Health Department announced they'd seen an increase never before seen. The COVID in our wastewater is 320% higher than last July. They tell us this predicts where we'll be in weeks in advance. That's why many hospitals are getting prepared for even worse conditions. Houston Methodist says they're opening areas they'd closed and putting them into service again.
We have created new capacity in new areas of the hospital to kind of fit patients in, whether those are obviously areas that were used by different parts of the organization. We're turning them into inpatient beds.
They've also been actively hiring more staff and even slowing down the surge volume.
We would encourage you not to come to the emergency room unless you absolutely need to. They are fuller than I possibly have ever seen them before.
The Harris County Health System says they're already maxed out. They tell us they're making room for more stretchers in hallways near nurses' stations. But their biggest problem is the staffing. They're asking staff to work overtime and they're trying to hire more.
We're turning every stone and identifying agencies that provide nurses.
And even if the county wanted to step in and create a field hospital, their hands are tied by the medical worker shortage.
Right now, our rate limiting step appears to be nursing, quite honestly. And I'll tell you what, right after that is going to be physician staffing and respiratory therapists. But right now, it's the nursing shortage.
Well, doctors are even more concerned because last year there were measures in place to help stop the spread of COVID, like the mask measures and the stay-at-home order. But of course, this year there are no such measures. Live, Anayeli Ruiz, KHOU 11 News.